What is going on, gangers? Brother Namdi back at your service, and I'm here to dive into a continuing series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you are subscribed to my channel. For part 16 of this series, we are going to dive into a fictional character that people may or may not know, and his name is Captain Yami from Black Clover. I decided to use Irritable Bowel Syndrome to describe Captain Yami's condition. Let's first dive into what Irritable Bowel Syndrome actually is. Irritable Bowel Syndrome is basically recurrent abdominal and GI symptoms that lead to constipation, diarrhea, or both. Going forward, we are going to label it as IBS. The causes are unknown, but there is a link between GI tract, immune system, and nervous system abnormalities. Risk factors that are included are gender, females are more affected than males, age, which would be more common in individuals under 50 years of age, but 50% of them have symptoms before 35, family history, basically meaning if your parents had it, you are twice as likely to have it, previously having gastroenteritis can lead to IBS, stress is a risk factor, and smoking. Also, let's note alcohol is not a risk factor but can lead to worsening symptoms of IBS. To link this with Captain Yami, he usually is smoking cigarettes, and we occasionally see him drinking alcohol, so he is of risk factors for this. Now on to signs and symptoms. This would include constant and recurrent abdominal pain, bowel movement abnormalities that results in diarrhea, constipation, or a mixture of both. Also have bloating, which is feeling of fullness, flatulence, which is the medical term for farting, and frequency/urgency to use the toilet. Now, if you refer back to Black Clover, we've seen on many occasions where Yami has to take numerous of quote-unquote dumps. It doesn't confirm if he's having diarrhea or constipation, but we are just giving a similar term for what he may be going through. In terms of diagnostics, there's no specific tests for diagnosing IBS, but we would use a Rome IV IBS criteria, and this basically goes through the pattern along with the frequency and the appearance of someone's bowel movements and their stool. We could also do other testing to rule other things out, and that would mean for infection, we would do a stool culture. To rule out anemia, we would do a blood test. And to rule out anything related to cancer, we would do an endoscopy. Now for treatment, we want to do the following. Reduce stress, meaning exercise, yoga, or meditation. Limit greasy/fried food intake. Also limit alcohol and smoking intake. If constipation is a symptom, we want to increase the fiber, take laxatives, and or stool softeners. If diarrhea is the problem, we can take Imodium or Pepto-Bismol. If it's just abdominal pain for the issue, then I would recommend peppermint oil. We could try to attempt to get Captain Yami to stop smoking and drinking, and I'm sure he would get better results. As always, if you have any of these conditions, please seek help, because at the end of the day, you matter. Fictional characters were used to give a different perspective in a situation. If you appreciate this video, please like, comment, and subscribe. If you haven't already, please check out the previous 15 parts to this series. And if you have a suggestion for part 17, please drop it in the comments. And if nothing else, y'all take it easy.